Thank you. I'm Peter Embarek. I'm working in the Department of Food Safety and Zoonosis in WHO at headquarters. My background is in food safety and food technology and food science. Um, I have 20 years of experience working in FAO and WHO on food safety aspects of different aspects of food safety. In WHO, I have been in the past developing the organization's risk assessment for microbiological hazards in food. It's a new program that started 10, 15 years ago. And we have developed a lot of new methodologies with regards to how to make quantitative risk assessments for hazards in food. So very complex process that is somehow different than the risk assessment we're talking about today, which is rapid risk assessment during events or emergencies. Currently, I'm managing the Infosan Network in WHO. Infosan is a network of all the national food safety authorities in the world. And we use this network to communicate rapidly and directly with national authorities in charge of managing food safety crisis, either when there is contaminated food circulating in the international trade and that needs to be recalled from the market, or when you have outbreaks of foodborne disease affecting multiple countries and there is a need for coordination, sharing of information, sharing of data, etc. I'm also managing the WHO task force on MERS. MERS is the Middle East respiratory disease affecting mostly the Middle East. We're conducting risk assessment on a fairly regular basis. So I will give you a couple of examples. With the MERS disease affecting countries in the Middle East in particular, but also other countries when they get imported cases, we recently, for example, had an event where we saw a new outbreak of MERS in one hospital in Saudi Arabia. This was a particular event because we saw transmission within the hospital, but there was no clear indication about the index case in that hospital outbreak. And the picture was complicated by a continuous influx of patients with MERS coming from the outside, being treated in the same hospital, but not necessarily part of that outbreak. So it was a little bit complicated and unusual situation. So by regular communication and sharing of information with the local authorities in charge of that event, we were able on a continuous basis to assess whether this was similar to previous hospital outbreaks we'd seen in Saudi Arabia and other countries affected by MERS, or whether we were seeing something a little bit different with a much more wide and perhaps also local transmission outside of the hospital environment. And that's typically the type of quick, rapid, ongoing risk assessment we would do over several days when we see suddenly a new picture, a new set of data, a new outbreak, a new number of cases popping up in one particular location. And depending on how quickly that event is brought under control, the risk assessment would typically follow the development of that event on a continuous basis. In this case, we quickly could basically conclude out of the assessment that it was one of these classical hospital outbreaks that we've seen in the past. We also quickly could see that the local authorities had put in place what was needed to bring it under control. And there was still some uncertainty about why there was so many cases coming out of the community into that hospital. But that part of the assessment, because there was no more data, more detailed information about these cases, or the investigation into the source of their infection in the community, we were not able to conclude anything new or different or even make any conclusion on the source of their infections. So it was a kind of the type of unusual assessment where you would be able to make some conclusions and about part of the situation, and maybe on some part of the situation you are not able to make any conclusions. So it's part of the daily frustration of dealing with unknown or unfamiliar events where what's happening on the ground is not following what you learn in the books or in the guidelines or in the manuals. It's not always following step 1, 2, 3, 4, 5 in doing an assessment. It's sometimes using your common sense, your experience, mixing information from different sources, talking with other experts and colleagues working on the same event, and making, at the end of the day, a best judgment conclusion. Now I will give you another example coming from the food safety side, where we manage events affecting multiple countries, again, either depending on whether food has been traded internationally and is contaminated and need to be removed from the market, or an outbreak of foodborne disease that affect multiple countries. So this is an example of an outbreak of hepatitis A happening in a country. And we first, of course, pick up either through the news or through our network of contacts in different institutions, different countries, and through the Infosan Network, information about an outbreak of hepatitis A in that country. Then quickly, the big question is, has a source been identified? Can we link these cases to a particular source? Because the whole idea is to stop or make sure that we don't have more cases linked to the same source. So basically, identifying the source and then being the source of infection for further human cases. So in that case, very quickly, the investigation at the national level was linking this outbreak to frozen berries imported from another country. And that took, of course, a little bit of time because hepatitis A is not easily identified from a food source. It's relatively easy to identify it from a human case, but then going back to the source is often a little bit difficult. Anyway, in that country, they were able to identify some frozen berries coming from one country as the source of this outbreak. So in that kind of situation, we would then use our historical data, our common knowledge of this type of events to, first of all, assess whether this is totally unusual or whether it is, again, one of these relatively well-known situations. So outbreaks of hepatitis A linked to frozen berries, we have seen that increasingly on many occasions in the past decades. So having another one was not in itself so unusual. Then the second point is the source of these berries unusual? Is the environment in which this outbreak happening unusual? As it has any particular feature that would raise our alarm and make us worry more about this one rather than another one? So again, in this case, you look at historical data, you look at the producing country. Have they been linked to other similar outbreaks in the past? Do we know that they have similar problems on a regular basis? And in that case, this country had been part of other outbreaks with frozen berries in the past. So unfortunately, not an unusual situation, not a new source, not a new food implicated, and the same pattern of transmission. So again, the type of assessment that you would do quickly to help you decide, are we facing a potential new large-scale unknown emergency, or is this one of these unfortunate but regular outbreaks that either local authorities can manage, or whether they can manage with the help of the international community and WHO in particular. So in terms of managing the outbreak in the first country, we know that the country has the capabilities to deal with this outbreak. As with regard to the source, it's also important as part of the assessment to figure out whether the same products have been exported to other countries. Because if that is the case, then we have to also inform these countries that they have imported something that potentially will create an outbreak in their country as well. So that's the next step in that process. So we did that by again communicating with the local authorities in that countries and find out that luckily that batch had not been exported to other countries, and then we could conclude the assessment by saying that this was a limited outbreak. So we use the Infosan Network to assess and manage events linked to food, so foodborne diseases and events where contaminated food is circulating in international trade and needs to be removed from the market to avoid an outbreak or to avoid further cases. So we use this network to communicate quickly, because when you do an assessment and when you manage a food safety events, time is the essence. For example, case of contamination with botulinum toxins, you really need to act within hours to make sure, because these are very serious, life-threatening contaminated products that may kill a lot of people if they are consumed. So to be able to do that, you need to be able to share information very quickly. So by having that network that links national authorities in all the countries, we can put them together in contact with each other and share that type of information. We can also help countries with assessing and accessing laboratory test capabilities in a nearby place if they don't have themselves. We can put them in contact with local or regional expertise if they don't have that, etc. And we can also put them in contact with other countries who have experience in managing that type of outbreaks. On average, Infosan manage 35 to 45 large important events on a yearly basis. Voluntarily, we concentrate on the important events from a public health point of view. If there is a foodborne event in your country, you will probably be part of that local response and local management of the event. Foodborne diseases are a little bit more complex to manage than a communicable disease or a disaster event and so on, because it involves usually a very large number of agencies. You have health, you have animal health, you have agriculture, you have trade, you have food agencies, sometimes you have fisheries agencies, you have many different agencies, not mentioning communicable disease and surveillance functions in the countries, all need to be linked up and work together in this type of event. So